This is VOA Africa.
Hello, I'm Esther Githui-Ewart. It's Wednesday, March 24th. Welcome to Africa 54. We continue to work remotely because of the COVID-19 pandemic. But what hasn't changed is our commitment to bringing you the latest and most important news from the African continent and around the world. This is today's Africa 54. Following months of denials from both the Ethiopian and Eritrean governments, Prime Minister Abiy Ahmed has confirmed that Eritrean troops entered the country's northern Tigray region during a 5-month-old conflict. Lisa Bernard has more.
Ethiopian Prime Minister Abiy Ahmed has confirmed that Eritrean soldiers entered the country's northern Tigray region during a 5-month-old conflict. It's the first such acknowledgement following months of denial from both the Ethiopian and Eritrean governments. Fighting erupted in Tigray in November after forces loyal to the region's then-governing party, the Tigray People's Liberation Front, attacked Ethiopian military bases. Speaking in Parliament on Tuesday, Abiy said Eritrean troops had crossed into neighboring Tigray because they were concerned they would be attacked.
The reason they show their presence is because they have a national security concern. We also informed the Eritrean government that they are being accused of wrongdoings, lootings, and other things. The Eritrean government strongly denounced these allegations and said it will take strong measures on any of its soldiers found guilty of these accusations.
Dozens of witnesses in Tigray have said Eritrean soldiers routinely killed civilians, gang-raped and tortured women, and looted civilian households and crops. Rights groups such as Human Rights Watch and Amnesty International documented the alleged killing of hundreds of civilians by Eritrean soldiers in the holy city of Aksum. Eritrea's Minister of Information was not immediately available for comment. Abiy also addressed reports of abuses by Ethiopian soldiers.
Any soldier or member of the National Defense Forces who raped our Tigrayan sisters or looted property will be held accountable by law.
The United Nations has raised concerns about atrocities committed in Tigray during the conflict. U.S. Secretary of State Anthony Blinken has described acts carried out in the region as ethnic cleansing, accusations that Ethiopia has denied.
That was Lisa Bernard of Reuters reporting. In Niger, flags are flying at half-staff and Koranic verses have been playing on state media beginning Tuesday as the country observes 3 days of national mourning for the victims of coordinated raids on villages in the southwest. Niger's government has vowed to do all in its power to combat terrorists after the death toll from the attacks on Sunday rose to 137. David Doyle reports.
The death toll from coordinated raids on villages in southwestern Niger on Sunday has risen to 137, the government has said, making it one of the deadliest days in recent memory for a country ravaged by Islamist violence. On Tuesday, Minister and government spokesman Zakaria Abdurrahman said the modus operandi of terrorists and armed bandits was to target civilians.
The government will do all in its power and is firmly determined to combat terrorists until the final victory. We have already taken measures to search, find and present to the tribunal the perpetrators of these odious, criminal and barbaric acts.
The attack took place in the Tawa region bordering Mali on Sunday afternoon. It's an example of escalating violence in Niger and the wider Sahel region, fueled by militants linked to Al-Qaeda, Islamic State and ethnic militias. Authorities have not said who they believe is responsible, though a security source earlier blamed Islamic State, whose local affiliate is active in the zone.
That was David Doyle of Reuters reporting. Congo Republic President Denis Sassou Nguesso has been re-elected with more than 88% of the vote, according to official results announced on Tuesday. This extends his 36 years leading the Central African oil producer despite a prolonged economic crisis. His closest rival, Guy Bourgis Parfait Colelas, who died hours after the polls closed, received less than 8%. Colelas was being evacuated to France to be treated for COVID-19 when he died. Diplomats and political analysts had expected an easy victory for Nguesso, 77, who has a firm grip on state institutions. The main opposition party boycotted the vote, and two of his other main rivals were convicted of crimes after the last election in 2016. Nguesso, a former paratrooper who took power in 1979, changed the constitution in 2015 to extend term limits that would have barred him from standing for re-election the following year. Wednesday, March 24th, is World Tuberculosis Day. As the day is being marked worldwide, doctors are warning that progress in the global fight against the disease has been set back more than a decade by the coronavirus pandemic. Henry Ridgewell reports.
Tuberculosis killed 1.4 million people worldwide in 2019. In 2020, the coronavirus pandemic overwhelmed health services across the world. In 9 countries with a high prevalence of TB, among them India, Pakistan, South Africa and Indonesia, diagnosis and treatment fell by an average of 23%, according to analysis by the Stop TB Partnership, a non-profit hosted by the United Nations in Geneva. They say the fight against TB has been set back by 12 years.
It's an impact on all the work that we tried to do, but also the finances that were spent, all the efforts of everyone. We are basically back to kind of square one of that time.
Like COVID-19, tuberculosis is a disease of the lungs caused by bacteria rather than a virus.
A lot of the people that are dealing with TB, doctors, nurses, healthcare workers, providers, were shifted from TB to COVID.
Hospital wards used for TB patients were rapidly converted into emergency COVID-19 units. As countries imposed lockdowns to fight the pandemic, TB diagnosis and treatment were again hit hard.
Usually, people with TB are the ones that are most vulnerable and are the ones that have a lot of difficulties in reaching the healthcare. And one of the reasons can be distance, can be money, such as poverty and other barriers. These things were actually exacerbated on COVID.
That means many patients are badly infected by the time they reach any clinic or hospital.
That's what a lot of the clinicians are saying, that they observe now some very, very bad forms of tuberculosis that they didn't see in many years. These bad forms of TB means that mortality will be higher. It also means that transmission within the household will be bigger.
Githui says there is an opportunity to claw back lost progress. The coronavirus pandemic has forced healthcare providers and communities closer together. By combining testing, contact tracing and treatment for COVID and TB, both diseases can be tackled at the same time. Scientists say urgent investment is also needed in new TB vaccines and treatments. Henry Ridgewell for VOA News, London.
Nigeria is one of the countries hardest hit by tuberculosis. However, an advocacy group says that despite the global pandemic setbacks, the West African nation has managed to maintain its progress. Timothy Obiezu reports from Abuja.
Francis Ekong was diagnosed with tuberculosis at the Asokoro Teaching Hospital in Abuja in September 2013. He says he contracted the infection while attending a job interview in his hometown in Akwa Ibom State.
I suspected that I actually drank from a cup somebody used, somebody who is a patient, because then I was just moving from one joint to another joint, drinking.
Ekong's family advised him to get his own apartment and isolate himself for treatment. It took months to get better.
The experience was a gory one. The pain, the sleepless night, I was having heat in my chest, my ribs, not able to breathe very well.
Nigeria is ranked among the top 2 TB-burdened countries in Africa and in the top 8 globally, according to the World Health Organization. An advocacy group, the Stop Tuberculosis Partnership, says global diagnosis and treatment of the disease dropped by 23% last year due to the pandemic, setting progress back to levels last seen in 2009. But the group's latest report also notes Nigeria, unlike many other high-burden countries, recorded a slight increase in TB diagnosis and treatment.
The Nigerian government actually is between the very few that were able to keep the focus on TB in such a way that we looked at the numbers of Nigeria, but we noticed that there is not a drop in the cases. So they succeeded to maintain the level of 2019 and even slight increase of around 8% in the number of people diagnosed and treated. So
officials say Nigeria achieved this increase by incorporating TB testing into the national COVID-19 response. Itohowo Uko is a director at Nigeria's National Tuberculosis Control Program.
We have some machines, diagnostic tools, like our gene expert machine. In some centers, we now integrate the diagnosis of both TB and then the COVID-19. And so when a person visits that center, the person will be tested for both TB and then COVID-19.
This month, President Muhammadu Buhari accepted a 3-year grant of 890 million from foreign donors to fight HIV, malaria, and tuberculosis. Officials with Stop TB Partnership say they're optimistic that even with the COVID-19 pandemic yet to be tamed, Nigeria will continue to improve levels of tuberculosis diagnosis and treatment. Timothy Obiezu for VOA News, Abuja, Nigeria.
Top U.S. scientists such as Dr. Anthony Fauci are joining hands with community messengers to encourage African Americans to get vaccinated, but the task is challenging. More with VOA's Veronica Balderas Iglesias.
Faith leaders getting vaccinated against COVID-19 at Washington National Cathedral aim to sow trust in Americans, particularly communities of color who have been hard hit by the virus. So says President Joe Biden's chief medical advisor, Dr. Anthony Fauci.
They have essential workers in the community, which puts them into contact with people who might potentially be infected. That's the first thing. The second thing is that once they get infected, they have a higher incidence and prevalence of the underlying comorbidities, which make it more likely that they will actually have a serious outcome from the infection.
Although 81% of Black Americans consider the pandemic a major threat to public health, only 61% want to be inoculated, according to a recent Pew Research survey. Some Maryland residents share the reasonings.
Viruses do mutate, so what's the point of taking one that's probably not even going to be able to take care of the new strand of the virus that they have out now?
I would say there's a side of, I like to call healthy skepticism, because I just don't want to put anything in my body.
There's still going to be skepticism because of the historical nature of how the United States of America has basically experimented on African American people.
The Kaiser Family Foundation reports a consistent pattern across 39 states. Black and Hispanic people are getting vaccinated at lower rates than whites. The foundation blames it on long-standing inequities and access barriers, not just hesitancy. Frontline worker Shandia Young said even trying to learn more about the COVID-19 vaccine from government online sites has been frustrating.
The websites aren't even up and running right. I mean, y'all got to fix your websites for people to really get the real information.
Dr. Fauci told VOA a new and easy access website will be running soon, and other steps are in the works to get vaccines to people of color.
We're now stocking up close to 900 community health centers from HRSA that will be specifically looking to get a greater proportion of minorities. We're putting into the pharmacies doses of vaccines in pharmacies that are located in areas of high density of minorities. We're using mobile units, and we're increasing greatly the number of people that are actually doing the vaccinating.
In the Washington metropolitan area, local governments have partnered with churches to better distribute vaccines to those who've been underserved. And non-religious groups elsewhere are beefing up information drives, stressing the benefits of the shots. But despite all that, healthcare advocate Mike Brown doesn't expect minds to change overnight.
Some people are just still not convinced, and it's because they never really been exposed to a decent healthcare to understand to take care of yourself, to protect yourself, that this thing is serious, because they have no education on well-being.
Kim Harper, who got her first dose of the vaccine, says she just can't understand the reluctance among some fellow African Americans.
The research that created these vaccines was done by a black woman. So I have people in my own family who will say to me, you shouldn't get that vaccine. And I say to them, this is my life. You can risk your life. I'm not going to risk my life.
Veronica Valderas Iglesias for VOA News, Washington.
Ongoing research is showing that it is likely the coronavirus which causes COVID-19 may be a zoonotic disease that first appeared in bats. A team in the Philippines studies diseases carried by bats in hopes of preventing future pandemics. VOA's Arasha Basadi has more.
Nighttime in the Philippines. A team of scientists using nets captures a wild bat which receives an impromptu medical screening. Scientists swab the animal's mouth, take measurements, and inspect the wings.
What we're trying to look into are other strains of coronavirus that have the potential to jump to humans. What are these areas that have the potential to be the ground zero for coronavirus infection?
Bat ecologist Philip Alviola with the University of the Philippines is on the research team studying bats and zoonotic diseases. The very nature of their work puts them at risk of contagion. They use the data collected from health screening bats to create a simulation model.
If we know the virus itself and we know where it came from, we know how to isolate that virus geographically. So we can implement some travel restrictions. We can prevent city-to-city, province-to-province transmission.
The model projects how time, climate, and temperature may affect the transmission of disease from bats to humans. The International Union for Conservation of Nature says there are more than 1,200 species of bats and at least 78 of them live in the Philippines. The World Health Organization and others have been studying whether the coronavirus pandemic started in bats because the virus has a similar makeup to others that the flying mammals are known to carry. Arash Arabasadi, VOA News.
We'd like to hear what you think about Africa 54 and the stories we cover during the discussion on Facebook. The address is Africa 54. We're also streaming our broadcast live on Facebook. Please watch and share our show with your friends. Also, check out our headlines 24/7 on voaafrica.com. Still to come. A Nigerian non-profit organization seeks to empower more women by equipping them with technology skills. We'll be right back.
Hello, welcome to Straight Talk Africa, live from the Voice of America headquarters here in Washington. I am Shaka Sali. Straight Talk Africa, we call it like it is. We discuss issues that reflect the interests of our audience without fear or favor. We are guided by facts, and I look at myself as a servant of nothing but the truth.
Welcome back to Africa 54. U.S. lawmakers are taking a new look at a decades-old law that grants U.S. presidents sweeping powers to wage war overseas. Congress may attempt to take back some of that power. VOA's congressional correspondent Catherine Gibson has our report.
For the first time in nearly 2 decades, the congressional authorizations justifying U.S. conflicts in Afghanistan and in Iraq, and then stretch to include engagements ranging from Syria to Yemen to the strike against Iranian General Qasem Soleimani, are under consideration.
Over 20 years, successive administrations have interpreted and reinterpreted the text of that resolution to use it in new countries against an expanding list of loosely connected groups. This process has all but cut Congress out of its fundamental responsibility to decide issues of war and peace.
Under the U.S. Constitution, Congress has the power to declare war, but the 2001 and 2002 authorizations of use of military force gave U.S. presidents broad powers to engage overseas.
Presidents increasingly go it alone and tell Congress the bare minimum about military actions. Presidents and their lawyers look to a 20-year-old authorization of force to justify their actions. If we do nothing, we shouldn't be surprised by the outcome.
That debate revived earlier this month following renewed tensions between the U.S. and Iran. The White House signaling it is willing to work with Congress to repeal those authorizations in favor of a narrower framework.
They should include concrete consequences, like a funding cutoff with a shorter clock. Put the president and executive branch officials on notice from the outset that if they can't get congressional support for their actions, their funding has an expiration date.
Past efforts to repeal the authorizations have met with opposition from presidents on both sides of the aisle, as well as Republican criticism it could hamper the U.S. response to terrorist threats.
We have the same goal here. We may have just a little bit different means of getting about it. We should also avoid dismissive talk of forever wars because it implies that our ongoing counterterrorism engagements are illegal and unnecessary.
As a senator, Biden worked for greater congressional oversight over presidential war powers. Now that he's in the White House, there is a sense Congress can reassert control over one of its most important responsibilities.
It is a fundamental question of leveling with the American public and holding the president accountable for the justification that he or she proposes to provide.
Legislation repealing those decades-old authorizations has already been introduced in the U.S. Senate. Catherine Gibson, VOA News, Washington.
In our technology news, the global advancement of women over the last few years has not gone unnoticed. However, critics say more work remains to be done to reach gender equality in innovation and technology. In Nigeria, a non-profit organization uses innovative approaches to encourage more women to pursue technology careers. For more, Africa 54's technology correspondent Paul Ndiho via Skype spoke to Oreoluwa Lesi, founder and executive director of the Women's Technology Empowerment Center in Lagos, Nigeria.
Ore Lesi, welcome to Africa 54.
Thank you so much, Paul. I'm happy to be here.
You lead an organization that empowers a lot of women in the field of science and technology. Let's start there. What do you do exactly?
Thank you so much for that question. I run a nonprofit called the Women's Technology Empowerment Center, WTech. It's based in Lagos, Nigeria. And what we do is we equip girls and women with technology skills. So for instance, programming, building mobile applications, website design, graphic design, robotics. And so we're really trying to get girls interested in technology and technology-related careers and supporting them as they start to pursue careers in technology.
When these young women come to you, or women in general come to you, what are their concerns? What is it they are looking for?
We work with girls in secondary school. So one of our flagship programs is our She Creates Camp, where we are working with girls between the ages of 13 to 17. And there we're helping them build technology skills, helping them to become technology creators, introducing them to role models already in the technology space. So when they come to us, I mean, they're still in school, so they're still open to learning a lot. They don't really have a lot of preconceived notions yet about, oh, tech is for me or tech is not for me.
Are there some examples of success stories of women that have gone through your training who are out there doing their thing?
We've empowered just over 31,000 girls and women. So that means that these girls and women have passed through our programs and they're now doing different things, not all of them in technology. So 86% of our alumni were inspired to work within science, technology, and engineering field after attending our program. We have close to 25% who actually went on to study a STEM-related degree or are currently working in that space. And then we have about 56% of our alumni who have been able to earn some kind of income using the skills that they got from our program.
Who inspires you?
Wow, so many people inspire me. I'm sure it's a cliche to say, you know, your mother, but that was my first role model anyway, because she was an engineer and she was doing so much. There's her, there's another lady in Nigeria, a former Minister of Communication Technology. Her name is Dr. Mobola Johnson, and she really inspires me as well.
Why is Nigeria, especially Lagos where you are, a very attractive place for all these tech companies?
It's a very dynamic city, and whatever is happening, you know, outside in the world, you tend to see it, you know, very quickly in Lagos, maybe more in Lagos than other parts of the country. I mean, there's definitely a huge talent pool here in Lagos. There's great access to technology. Also, because of technology, the internet, you really can be anywhere, especially in technology. You can live anywhere and then work, you know, remotely. Because of COVID, we're going to see, we've already started seeing more of that, you know, jobs are no longer tied to specific locations, but they're open to people, you know, wherever they may be.
How has this COVID impacted your business? How has it impacted the industry?
Well, it's impacted the industry, definitely. I mean, last year, I think, was really the year of tech. In case anyone was in any doubts, I mean, we now know that, you know, technology is crucial for businesses, it's crucial for economies, it's crucial for healthcare, education. We saw literally every facet of our life being mediated, you know, by technology. I mean, in our organization, of course, we started working from home. We were able to seamlessly move, well, I shouldn't say seamlessly, but almost seamlessly, you know, transit to working from home. We had to move most of our programs online as well. And we found that we were able to do so much more with technology. I think for an organization whose work is centered on technology, it also made me realize that we were not even utilizing the potential of technology even to the nth degree. There was just so much more we could do. Being online opened up our programs to the world. So we were working with girls and young women across continents. It's really been good in that sense.
Thank you so much for your time. It was a pleasure talking to you.
Thank you. I enjoyed the conversation as well.
That was Africa 54's tech correspondent Paul Ndiho speaking to Ore Oluwalesi, founder and executive director of the Women's Technology Empowerment Center in Lagos, Nigeria. And that's our show for today. Be sure to watch Africa 54 on our website at voaafrica.com. From all of us here in Washington, we thank you for watching.